My name is Rob Wipond. I'm an investigative journalist. During the research on my book, Your Consent is Not Required, these are the more startling, disturbing, and shocking things I learned. Definitely one of the more shocking things I learned about is the sheer extent of the mass-scale, blatant fraud going on in mental health care. Random people being locked up in psychiatric hospitals for profit. The main problem is that the definitions of mental disorders have become so broad, and mental health laws have expanded so much that these days practically anyone can get locked up. And I'm not the only one who's been noticing. For example, in 2019, the Tampa Bay Times ran this story: "You're trapped, they're cashing in." The journalist then hosted a Reddit discussion, and thousands of comments flowed in. This happened to me as well, but in Louisiana. I'm a psychiatric nurse in a hospital that illegally extends holds to fill beds. This happened to me in Georgia, Indiana, Texas, Pennsylvania, Virginia. I work in mental health, and every time I try to report serious abuses, nothing gets done. BuzzFeed did a series about universal health services, how scores of employees and patients say America's largest psychiatric chain turns patients into profits. Lots of people were just responding to their ads for free mental health assessments and then got locked up. ABC News in Denver ran stories for 2 years straight. Mental health facility accused of holding patients for money. Serious questions about billing practices. License revoked. Still operating. Racketeering. Over in Texas, same patient exploitation. How widespread is this? In 2021, I contacted the Medicare Fraud Strike Force. It's a collaboration involving the U.S. Department of Justice, Office of Inspector General, Department of Health and Human Services, and State Attorneys General. I arranged an interview with an expert in the Healthcare Fraud Division. The DOJ attorney described massive networks of patient recruiters, or body brokers, driving the streets, rounding up vulnerable people, and going to assisted living facilities and group homes, and throwing around kickbacks and bribes, and then taking people away in vans to incarcerate them in psychiatric hospitals. The attorney said, "People are bought and sold like cattle, literally, and that's not hyperbole." He described owners and operators of large mental health institutions and their psychiatrists and nurses working together to routinely falsify records in assembly lines of fraud, as they declared random people to be mentally ill and at risk and drugged them until they're docile, and then bill Medicaid ridiculous amounts of money for their care. The DOJ attorney directed me to lawsuits and settlements for millions, tens of millions, hundreds of millions of dollars, involving psychiatric hospitals, community mental health centers, detox facilities. Basically, a huge part of modern involuntary psychiatric treatment is organized crime, masquerading as responsible healthcare. You might guess that BuzzFeed story was a bit sensationalized, but actually in 2020, Universal Health Services, owner of 200 psychiatric hospitals, paid $117 million in a fraud settlement. The Department of Justice media release said that UHS hospitals in multiple states forcibly detained people who did not require or no longer required hospitalization, improperly used physical and chemical restraints and seclusion, and billed for improper and excessive lengths of stay. How can all this be happening if mental health is supposedly so underfunded and there's hardly any beds and even really dangerous people can't get committed? For answers to these and other questions, follow my videos or see my book, Your Consent is Not Required.